So today's topic is the testis, which is a male organ. So first, the shape of the testis is the oval shape, and it is the male sex organ. And the main function of the testis is to produce the testosterone. So this testosterone is an organ which is responsible for the secondary sexual characters in the male. And in the testis, the spermatozoa sperms are mature, sperms are produced. So coming to the external features of the testis, we have upper and lower poles, and we have two borders, anterior and posterior borders. We have two surface, medial and lateral surface. Coming to the position of the testis in the scrotum, as I said, it has two poles, upper pole and the lower pole. So coming to the upper pole, it is forward and lateral. Lower pole is backward and medial in the scrotum. And there are three layers of the testis: tunica vaginalis, tunica albuginea, tunica vasculosa. So it is the innermost layer. So it is the outer layer, outer to inner layer of the testis. So coming to the descent of testis. So normally in the third month of the intrauterine life, it is in the iliac fossa. Then in the 4th to 6th month, it comes to deep inguinal ring, and in the 7th month, it travels the inguinal canal, and in 8th month, it enters into the superficial inguinal ring, and at the 9th month, it reaches the scrotum. At the 10th month, it reaches the whole base of the scrotum. Coming to the factors responsible for this descent of testis is the hormone. As I said, this testosterone is normally produced in the testis, and increased abdominal pressure and temperature should also be responsible for the descent of testis, and contraction of the gubernaculum. So gubernaculum is something which extends from the testis to the scrotum. So when it contracts, the descent of testis also takes place. So coming to the external features, you can able to see it here. It is the internal features of the testis. So this is the anterior part of the testis. This is posterior part. So in anterior part, this tunica albuginea is presented, whereas in posterior part, it thickens to form a mediastinum testis. Okay, and this testis is normally divided into compartments, 250 compartments, which is known as seminiferous tubules compartments. Okay, as testicular lobules, that is, and inside the testicular lobules we have seminiferous tubules. So this is the seminiferous tubules. So inside these tubules, the germ cells are presented, which matures to form as sperms. So outer, this is known as interstitial cells, interstitial space. In this space, the Sertoli cells will be presented. Sertoli cells' main function is to give the nutrition for the development of the sperms, and it is also involved in the blood testis barrier. And coming to the blood supply of the testis, so this is the abdominal aorta. Okay, so from the abdominal aorta, testicular arteries are raised laterally. So right testicular artery and left testicular artery. So which mainly attaches to the testis. This testicular artery enters into the inguinal canal by passing into superficial and deep rings of it, and it supplies us the testis. Okay, and coming to the venous drainage, so from this is the testis. From testis, veins arises. This is known as papniform plexus. So this papniform plexus passes through the inguinal canal by passing through the superficial and deep rings of it, and it ascends up. So left testicular vein drains into left renal vein, whereas right testicular vein directly drains into the IVC, inferior vena cava. This is the main important thing. So left testicular vein drains into left renal vein, whereas right testicular vein directly drains into the inferior vena cava. Okay, this is the venous drainage of the testis. So coming to the lymphatic drainage. So lymphatic drainage normally, so this is the testis. We have lymphatic drainage that too passes through the canal, inguinal canal, and it drains into the pre and para aortic lymph nodes. The lymph nodes which is surrounding the aortic is known as pre and para. Pre in the sense it is the lymph nodes which is presented parallel to the aorta, whereas pre in the para in the sense which presented parallel, whereas pre in the sense in the front of the aorta. So this floats are mainly involved in the testis. So coming to the applied aspect, so testicular torsion is nothing but the testis get rotated and it get twisted so that the spermatic cord is also get in the spermatic cord the testis get twisted. Okay, so you can able to see the difference here. This is the normal testis. Okay, the spermatic cord arises. So from the normal, the testis get rotated, which is referred as the torsion. So this is the one of the clinical condition. So coming to the tumors, when there is something develops abnormally is referred as tumors, which leads to the carcinoma. This is the carcinoma of the testis. And cryptorchidum is nothing but when the testis, as I said, the testis descends down, right? So when this descends down does not takes place, is referred as the cryptorchidum. Whereas ectopic, the testis develops or reaches some other places while descending. It may be a superficial ectopic or transverse caudal or perineal. It may be ectopic in the sense some while descending down the testis will not reach the scrotum. Instead, it will reach some other areas like like prepenile behind the penis, transverse scrotum, perineal, like that. That is referred as the ectopic testis. So these are about the testis. Thank you.